Welcome to Medico online medical video. My name is Dr. Balla. In this video, I want to talk about definition of medicine. Now, medicine is an English word that derived from Latin. The Latin word is medicina, which is medicina meaning art of healing or ways of healing, and itself derived from the verb root mediri, which is a Latin mean to heal. Medicina also from it derived another word called medicus, meaning physician. Or a doctor. So this is where the word medicine came from. Now, medicine as a discipline and as a scientific, as a science, can be defined as the science and practice of diagnosis, treatment, and prevention of disease. This is a simple definition of science: the science and practice of diagnosis, treatment, and prevention of disease. Now, in order to understand this definition, we need to go through it in order to understand it. So, what we mean by saying medicine as a science? Now, science simply meaning knowledge, and it means concepts and theories. This is what we mean by saying sciences. So, concepts and theory. In medicine, we have concepts such as basic sciences, which is the basic medical sciences, which is at the root of medicine. Basic. Example of these basic sciences: anatomy, physiology, and biochemistry, etc. Now, these are the basic sciences of medicine. So, anatomy is the sciences of the structure of the human body, through which we understand what the human body structure from. The physiology is the science of the function of the human body, how we, for example, respiration, how the heart is working, how the brain is working. The biochemistry is the science of the chemistry on the biological sense, like the cell, how the cell, for example, produce energy. This is basically the basic science and the basic concept. Now, the theory in medicine, there is no theories, because most of when we talk about medicine in the basic form, all of these are factual. But in the past, there was theories such as germ theory of disease. But today, of course, the germ theory is considered to be factual, so it's not really a theory today, which say that some diseases are caused by pathogen, such as bacteria and viruses. This is, as I said, is considered to be a factual, so it's not theory. It was a theory, but in modern time it have been proven. Now, medicine as a practice, which practice can be defined as the art of applying medicine applying medical knowledge, the sciences. To treat patients. So practice is the ability of applying and the skill of applying medical knowledge in order to treat patients. Now, in the past, medicine was always a practical science, or practice have been applied as a practice, meaning before, because the scientific basis was not really well developed as the practical side, and people used a method of trial and error in order to treat patient. Now this is usually resulted in what we now call it traditional medicine. Which is a collection of knowledge and folk knowledge about mostly alleviating the symptoms that a complaint that the patient would have. Is not really well developed as modern medicine, because the scientific basis of it was not as strong as in modern time. Now, practice, of course, is the skills of the doctor in order to apply medicine in order, and all the science and practice we use it in order to reach a diagnosis, which is the third. And diagnosis is a Greek word meaning dia, apart. Gnosis is derived from a Greek word meaning recognition. And diagnosis can be defined as identification of illness or disease. Is a simple definition, and diagnosis is the key to medicine, meaning that in order that basically what medicine is, in order to diagnose. In fact, diagnosis is so important that it can be said a disease. There is a saying in medicine is a disease known is half cured, meaning that half of the cure of the disease is to know what is it. In fact, for the patient also, psychologically, in order to alleviate the burden of the disease on the patient, just to know what he is suffering from is very important for the patient. Now, diagnosis is a process, and this process includes history taking, and physical examination. And history taking and physical examination is done by the doctor in order to reach diagnosis, and it usually revolve around the sign and symptoms. The sign and symptoms. Signs is what the doctor sees in the patient, while the symptoms is what the patient complains of. So the sign would be like a rash, discoloration in the body or the skin. Symptoms would be like the pain, if headaches or disorientation, anything that the patient would complain of. And as the doctor develop this process, he will reach what we call differential diagnosis, which is a certain disease, the most suspected diseases that the doctor think cause the patient illness. Then he will move to the investigation, which is in order to reach a definitive diagnosis to start the treatment. So diagnosis is key part of medicine, that is essential of it. Now, the treatment can be defined as clearing, restoration of the normal state of health. In general, people used to say cured, patient is cured, but today we don't use this because cure implying that the patient become completely well and the disease went away forever. We say treatment because treatment is mostly as a process, because with treatment there is also management. And some diseases are not cured or treated completely. A lot of diseases which is related to lifestyle disease such as diabetes mellitus and high blood pressure, hypertension, are what we call lifestyle diseases. These require management, and general management contains from the lifestyle modification and drugs that it need a continuous monitoring for a lifetime, forever basically. So it's not, there is no cure generally for diabetes and hypertension. And disease and treatment in general is according to which disease the patient complain from. Now, with treatment, of course, also there is the prevention side of it. As I said, prevention is an integral part, there in fact an entire branch called preventive medicine, which deal with this topic. And prevention again is according to which disease. So for diseases that chronic, or to call it chronic disease or lifetime disease like diabetes mellitus and high blood pressure, the prevention side of it usually including lifestyle modifications such as weight loss, eating healthy, following a continuous monitoring process in order to manage or prevent this disease from progressing very further. And this is the prevention side. So treatment and prevention with management are can consider to be a complete process. Now, disease itself can be defined multiple ways, but disease means the departing or dysfunction of the normal state of health. And anything that affects the normal state of health is considered to be disease. So there is cannot be, for example, a very good classification to include all the diseases or all the illness that can affect the normal state of health. But in general, there can be a simple definition in order to understand disease, such as internal causes and external causes. Internal causes, this is of course classification according to the causes of disease. So internal causes would be like autoimmune disease, which is due to there is a dysfunction in the normal immune system of the body that resulting in the body start to attacking the body, which result, and it can be caused by, of course, external and internal, but in general is considered to be internal because the dysfunction is in the immune system. Another example is tumors, which due to mutation in the cells that result is in tumors that either benign or malignant. And now external causes are like infection by pathogen, like viruses and bacteria. Now, the classification that is known and world recognized in the international is the classification by the World Health Organization known as the International Classification of Disease, ICD. The current version of it are known as ICD-11, which was developed since 2019, was released and came into effect in 2022. Now, ICD-11 contain around 85,000 classes or node group of disease that contain it in the ICD-11 and can be reviewed in the website of the ICD-11. This is which provide the classification of disease. Now, in summary, so the definition of medicine, as I said, this is the definition of medicine: the science and practice of diagnosis, treatment, and prevention of diseases. In the next video, I will talk about the history of medicine. Thank you for watching.